So thank you very much for the possibility to present to you today the Swiss approach to use and exchange of interoperable health data for research. I would like to start out with a few facts about Switzerland. As you probably know, some of them already, we are about 8.5 million inhabitants living in 26 different cantons here in Switzerland. We have 4 official languages, but most of the medical data, let's put it like this, is kept in 3 of them. We have 5 university hospitals with a total of 281 hospitals, and the healthcare providers are a mix between public healthcare providers, private ones, and subsidized ones. We have luckily one national law, the Human Research Act, that regulates also the further use of health data for research, but we have different cantonal data protection laws. We were able to narrow down the number of cantonal ethics committees in the last years down to 7. And thanks to the Human Research Act, we have the possibility of a broad consent so that patients or citizens are able to sign a general consent, as it's called in Switzerland, in order to give permission to use their health data for research purposes. So in 2017, the Swiss government launched the Swiss Personalized Health Network. This is a research infrastructure initiative. And we have a very clear mandate for the first 4 years. We had to focus on the 5 university hospitals. In the second phase, coming now from 21 to 24, we would like to consolidate the network that we have built up in the last 4 years and also expand it to different data providers throughout the country. So the clear aim is...
Sorry to interrupt you. Your slide, it's not full screen. So maybe we could see it better if it's full screen.
So for me, it is full screen.
No, we have, yeah, now it's larger.
Is it now full screen?
You shared your screen, not your application. That's why it's not full screen.
Sorry. Okay, I will stop. Thanks for letting me know. So we try again. Okay. I cannot share my PowerPoint application, but maybe I can. Quickly do this.
At the bottom of the sharing applications, you can also, you normally have a list of apps that are open.
Yeah, I have to upload it. I don't know why, but it's uploading right now, so you should be able to see it in a second.
Yeah.
Is it better now?
Yeah, it's
okay, great.
Better. Thanks a lot.
Okay, sorry for that. So let's go back to the overview slide. As I was saying, we have the second phase in front of us to consolidate and expand the network also to other data providers in Switzerland. So our clear aim is to build coordinated infrastructures to make health data interoperable and shareable for research in Switzerland. And this means overcoming the cantonal borders and the challenges that come with a federated country. So when we look at the data streams for data-driven biomedical research or personalized health research, we can basically identify 4 types or sources of data, right? There is the data from healthcare institutions. This is the routine data or specific routine data that we normally have stored in hospitals, for example. Then we have the molecular or omics data. This is rather coming from the laboratory settings, so genomics, transcriptomics, proteomics data. Then we have the clinical research data, also the cohort data, so longitudinal studies, registry data. This is normally high quality patient-oriented health data. And we have healthy citizen data that comes, as you said before, from the citizens directly fed into the system, consumer data, lifestyle data, social media data. So SPHN is focusing on predominantly the 3 of hospitals, molecular and clinical data, not so much on the healthy citizen data, at least at the moment. But when it comes to the data streams or the data types, we need to have fair data, right? We need to to find the data, to access the data. We need interoperable data, otherwise we cannot bring it together, and we ideally should be able to reuse the data. So in SPHN, if I can go forward here, oh, sorry for that. Yes. So this is our network, basically. We have the 5 university hospitals, as I said. We have in Basel, 1 in Zurich, 1 in Bern, 1 and in Lausanne and in Geneva. Attached to the university hospital, there's also always a cantonal university with a medical faculty to it. And we have the 2 national universities, the ETH in Zurich and the EPFL in Lausanne. So these are our regional actors, if you wish, of the data providers and also the data users in the different regions. What we also have in SPHN conceptualized from the beginning were the clusters. So there is a personalized health alliance, for example, between Zurich and Basel. So these are building one cluster. And we have the French-speaking part cluster in the western of Switzerland. This is the Health 2030 initiative. But we also have, in addition to the bridging clusters, we have initiatives within one region. So, for example, we have the Loop in Zurich that try to bring data together from 4 different university hospital-attached hospitals. And these initiatives, the spanning one, but also the focused ones, of course, also help us on a national level in order to streamline procedures, in order to clarify, let's say, governance, regulations, access to data in general, but also, of course, bring up the problems and challenges when it comes to interoperability of data and help us to work on the national efforts when it comes to the findability and the accessibility of data. So SPHN decided to go for a decentralized approach, which is, I think, the only approach we are able to do in a federated country federal country like this. So we didn't go for a central data lake, but the data stays with the data providing institutions. And it is only gathered when it is has a very specific use in a specific project. So basically what we can do nationwide is a federated query system. We are in the process of building this right now. So basically researchers can query what kind of data would potentially be available for their research projects and what kind of patients are in the hospitals that they could include potentially into their research projects. But then we basically go in building a project as we would be used to it in the past. Also with other data, we have to basically bring data together from different sites, and we have to have an ethics approval, of course, for this. We have to have a research plan, and the data is copied for this project, but the data stays at the sources where the data is basically kept or captured. SPHN aims to get data out of silos, so we would like to work towards a fair use of health data for research, and with this also a more democratic access to the data, so that not only the researchers that basically work in an institution like a university hospital have access to this data, but data can be shared with other researchers outside of this hospital setting. And we would like to build and connect and align the system. So what we're currently building is a national infrastructure network and a central interoperability strategy behind it. And what we do since 2 or 3 years now is we try to harmonize also the processes, but I will come to this later. I would like to mention that SPHN has a sister initiative working very close together with us from the ETH domain in Switzerland, and they're basically funding the research projects while we are funding the infrastructure development, which is a very good handshake, because you need basically both, right? We need to build the infrastructure and then also have our proof of principle or projects on top of it to be able to really iterate and streamline the development. When we look at the different SPHN infrastructure components, this is just a selection of it. So the main or focus of the first 4 years was to develop research data management systems, or so to say clinical data warehouses, at the 5 different Swiss university hospitals. This was a huge investment of the hospitals, also of SPHN, but the hospitals give a lot to the development of these infrastructures. And since these are all different houses, partly also in competition with each other, you can imagine that this is not a streamlined process. Everybody builds something that is good for their institution, but we try to bridge them nationally. And this has been has had a very slow start. Let's put it like this, where everybody had to get used to the fact that now we have to communicate transparently and talk to each other. But now this is working quite well. We also have a second approach of bottom-up infrastructure establishment projects throughout the country. So we fund 11 large multi-site driver projects that already use the data that we have in these university hospitals and bring it together in research projects with different foci. And also we have infrastructure development projects looking at very specific topics and develop this further in order, when they are successful, to be rolled out throughout the country. We also like to verify omics data, cohorts data and time, and cohort and registry data, and we're building a network, a national infrastructure where we can use this data on, but I will also come to this in a second. So how do we bring it together? Maybe for this workshop today, this is the most important slide. So on the individual level, basically, we have, as I said, the possibility to sign a general abroad consent. This helps us to really be able to use the data for different research projects. On the data provider or gatekeeper level, basically, what is very important is to address and then clarify the governance, because the governance is different in every hospital, in every data providing institution. And we have to basically, address it. We have to build or stabilize a legal architecture. So what we came up with is basically the development of national templates for legal agreements between the data provider and the data recipients, but also the data processors. So we have consortia agreement templates, data transfer and use agreement templates now in place, processing agreement templates, which helps the researchers to really get basically the allowance of the data transfers and the data access in a more streamlined fashion than we had before. Process innovation is also an important factor in SPHN. We have to adapt the procedures and frameworks to the new developments. We share best practices from one region to the other and the solutions, and we also learn a lot from each other. And on the regional or also national level, there we always have the premise to federate where possible, and we gather where necessary. So we also would like to go into the federate compute possibility, that the data really stays where they are. We send the workflows into these clinical data warehouses, for example. We try to connect all of the partners in Switzerland to the university hospitals in our network. These are technology platforms, the biobanking, Swiss biobanking platform, the clinical researchers in the Swiss Clinical Trial Organization, and also the funders are important to bring on board. And we provide with the Biomed IT network that we are building as an integral part of SPHN, we are building a secure and protected environment where you can use the data. We have to transfer the data securely, store the data securely, manage and process the data. And ideally we do not do that on our personal laptops, right? So we built this Biomed IT network with the idea of providing researchers a secure and protected IT environment where they can process their data without basically necessarily having to pay attention to IT security issues of their technical systems. So basically, we have an end-to-end process. We have hooked up all data providers to the system now. There is an end-to-end encryption of the data transport from the data provider to our network. Within the network, we have basically a one-stop shop where the researcher can find everything and remotely work on their data, having a cutting-edge technology environment of offering cloud computing, big data storage, high-performance compute, which you need when you have like machine learning approaches or other approaches in personalized health research. So this is basically the way we also convince our partners in the network that we have this environment, that they see us as a trusted partner in terms of exactly the scenarios that you were referring to before. Ideally should not happen because we have a secure environment to process this data. And I would like to end with a statement that we are very convinced of in SPHN. Healthcare and research must go hand in hand in the digital learning healthcare system of tomorrow. So thank you very much for your attention, and I'm happy to take questions.
Thanks a lot, Katrin, for this very interesting presentation. So it is possible, even in complex federated countries. I have different questions, but we don't have that much time. So I will start with the question of Katrin. Is the data accessible for research only or also for industries, or is it only for the researcher at university hospitals?
So the research is the data is basically accessible throughout our network for all researchers of research institutions in Switzerland. We are currently elaborating a public-private partnership policy because we have the clear mandate that we also would like to have concrete projects. So it's not that industry can just take the data, right? It has always to happen in the framework of concrete research projects. But the idea is that we have partnerships with the corporate world in the second phase for very concrete research projects as well.
Thanks. So there are specific access requirements. They have to explain the project and what they will do with the data.
Sorry, can you say that again?
Yeah, sorry. So there are specific access requirements. So if they want to use the data, they have to explain the project and what they are going to do with the data.
Yes. Yes. So this is what we have now currently in this legal architecture. Basically, we have very clear restrictions from the data providing sites, what is accepted, and it has to be outlined at the beginning in a research proposal. The research proposal needs ethical agreement from our cantonal ethics committees, and it's very clear for what the data is being used and by whom.
Yeah, thanks a lot. And in the patient's perspective, so you have this consent. Do the patients ask for what is going to be done with their data? And so there is, I guess, a possibility of withdrawal. And do they use that right or not?
So the patients in Switzerland currently do not have a possibility to basically see on their smartphone for what kind of projects their data are currently being used. This would be a goal in the future to really have this kind of also dynamic consent that you can really check or really agree to what kind of projects you want to share your data with. This is not happening at the moment. What we have in place, of course, is a consent management. So basically, everybody who withdraws their general consent, they can do that at any time. And this is the good thing in a decentralized network, right? That because the data where the data is being kept, where it is captured, and so also the consent management at the moment is handled at the university hospitals. So if somebody withdraws, and this is a very, very small percentage of patients currently doing this, the hospital basically just puts the button on no, and then this data is not been shared anymore.
Okay, thanks a lot. So